Now, all this week, we've been on a mission to help beat the waiting list by giving you direct access to some of the country's top medical specialists.
Today is all about skincare, and here to answer your questions this morning is top dermatologist Dr Emma Wedgeworth. Good morning.
Good morning. Thanks for having me.
Thank you for coming in, because people at home are loving this. It's hard to get in to see someone like yourself, so you're here to help people, but you got some early tips for us to get us up and running. What are they?
Definitely. The first one is protect your skin from the environment, so particularly the sun. We know that the sun is the major damaging factor to your skin, so just be careful and wear your SPF every day. That's number one tip. OK, good. Number two tip? Number two, so just be really careful about your skin. So just make sure that when you're washing it, that you're not using anything that's too harsh, you're using nice tepid water. Be gentle with it. Your skin has to last you a long time, so just protect that skin barrier. And then the third thing is treat any medical condition that you might have. I mean, we know that a huge amount of people have skin conditions, and we can treat most of these. So anything that you're worried about, for example, with me, I might get some hormonal breakouts, and I'm going to use a cream every day that can try and prevent some of those.
My best friend came round the other day. I said, what have you used on your skin? It looks absolutely incredible. And she ran out of her usual face wash and she went for her intimate area wash. And I think because the pH balance is quite neutral, her skin was amazing.
Wow. No, that is... I would rather you didn't use an intimate wash.
OK.
Just leave that area well alone, but actually use something really nice and pH balanced on your face. So I think she's made the right swap.
Noted. I'll let her know. Thanks, Emma. Thank you.
Raw honey. That's used in our house.
Yeah, you were telling me about this. I am not keen on foods being used on the skin. Keep the foods in the kitchen and keep your skincare in the bathroom. We want that distinction.
A lot of lads here wear kebab on their faces on Friday night.
Kebabs are fine on a Friday night.
Is it all right?
That's totally
fine.
Right, we've wanted to give all our listeners direct access to you. You've been very, very popular. Laura, we're going to go straight to our first caller, Laura. Now, Laura, what would you like to ask Emma?
Yes, I wanted to ask Emma. I have been diagnosed with lichen planus, which is affecting my skin, a little bit on my scalp as well. I've been put on oral steroids and steroid cream, which I've been told long-term is not ideal to stay on, especially the cream. As soon as I stop using the cream, the spots seem to flare up again. So while I'm using it, it seems to keep it at bay, but certainly when I'm not using it, it flares up again. So I just wanted to know what kind of thing I could do, anything natural, or how to find the cause of it to stop it from happening.
Thanks, Laura.
Yeah, thanks, Laura. So I'm really sorry that you are having this, because it can be really uncomfortable and itchy. For anyone who doesn't know, this condition, lichen planus, is a shift in the skin's immune system, which can produce these really itchy patches, which, like you said, Laura, can also happen on your scalp, occasionally in your mouth. And I know this probably doesn't seem like good news, but often the immune system will shift back. So this hopefully won't be something that you have lifelong. And sometimes it takes, don't throw anything at the TV at me here, 1 to 2 years to sometimes settle. But what we want to do is to really make everything as comfortable as we can for you. So itching can be a huge problem, as I know that you've said. Ingredients like moisturisers, there are things called Lauren macrogols, urea, all of those can really help with itching. And in the hot weather, put your moisturisers in the fridge, because that can be really nice and cooling. Silk clothes, I know that sounds ridiculously expensive, but there are some garments out there which are made for people with skin conditions, and 100% cotton can be really, really helpful. Using your steroid creams intermittently, you probably are going to have to help with that, but natural stuff, some studies have suggested that vitamin D supplements can sometimes help with lichen planus, so that might be another thing that you could try.
Do you dread the warm, sunny weather, Laura? Is it really difficult in the heat?
It has been really difficult, especially sort of wearing jeans or anything that's sort of scratchy on the skin. So wearing silk sounds very luxurious, but probably ideal. Is the sun worse? You know, if I go on holiday, will it get worse in the sun? What should I do to protect myself?
Really, really good point. Thank you for bringing that up. Actually, a little bit of sun exposure can be quite good for lichen planus. So as dermatologists, we can treat lichen planus with sun therapy. That doesn't mean I want you to go on a sunbed. It doesn't mean I want you to go out and get burnt. I've talked before about how important sun protection is, but a little bit of sun exposure may well help. So try and get out in the garden, the balcony, a holiday, just for a bit, but be really sensible in it.
Oh, good luck with that, Laura. Good luck.
Thanks, Laura.
Thank you very much. Thank you.
Thank you. Thank you.
We got Carrie on the line. Good morning, Carrie.
Hi.
Hi, how can we help you this morning?
Yeah, so I've had eczema on my eye for this time round about 6 or 7 months. Previously, it was about 4 years ago, and I used steroid cream on my eyes to heal it, which it did take away the eczema, but it did mean that I was left with this pigmentation. This, the photo is my eyes now, and the eczema, nothing I seem to do is fixing it. I don't really want to use the steroid cream again if I can help it, but I have cut out pretty much everything in terms of I've cut out sugar, I've cut out soya, dairy, I use completely natural products, I don't wear makeup anymore. Really, I've done so much to try and help it, but nothing seems to be easing it. It just seems to be getting worse.
So, hi, Carrie. This must be so frustrating, and it sounds like you've done everything you possibly can. I see a huge amount of eyelid eczema in my clinic because the eyelids are the thinnest skin in your body, and it's really prone to getting irritated. So, first of all, allergy is something that we do think about. Not so much allergy in what we're eating, but something that we might be putting on the skin, and that can even be to natural products. You know, things like essential oils and things like that can sometimes impact on it. So, definitely make sure that we're just stripping out any sort of fragrances or anything like that, which you sound like you have done. A good barrier cream, so making sure that we're using something that really protects the skin. Even something like Vaseline can be really, really helpful around that sort of area. Being very gentle, making sure that we're not using hot water, air conditioning, heating, those sorts of things can make it worse. And then sometimes we do need anti-inflammatory creams, and there are some different types of anti-inflammatory creams, the steroids, which are really good for the eyelid. We call these topical calcineurin inhibitors. So this is definitely worth going back to your GP or doctor and having a chat about an alternative type of cream that you can use on eyelids more safely.
Oh, we hope that helps, Carrie.
Yeah,
we hope that helps. Good luck with that. Next, we're so inundated for you. So I'm going to read this one from Claire. My 9-year-old won't go outside because of a growth on his lip. A large growth has appeared on my 9-year-old's bottom lip over the last 6 weeks. It has increased in size and it bleeds for a long time when bumped. What do you think?
Oh, poor chap. So the first thing is any new lumps and bumps, I definitely need people to go and get them checked out with a doctor because sometimes those things can be more serious.
Oh, here's a picture of it here.
Yeah, look. Luckily, this has been seen by a doctor and it's not likely to be serious. It's something called a pyogenic granuloma, which is this blood vessel little bump which can happen with children, also with pregnant women. I feel for you. I had one when I was pregnant with my first child and it was a nightmare. Compression, if it's bleeding, compression, ice, all of those things can help.
Okay.
And if not, seeing a doctor.
I should point out she is waiting for an appointment with a consultant, couldn't get one. You've done the job. Thank you so much for everything. Great help as always.
Thank you
so much.
for visiting our This Morning YouTube channel. We upload new content every day, so go ahead, hit that subscribe button. You don't want to miss out, and we'll see you in the morning.